to this terrible disease, COVID-19. Per always, I ask that we take a moment of silence to remember those who we've lost. Thank you. In order to get through COVID-19, we always want to provide our residents with the tools necessary. One of those tools is COVID-Wise, the COVID-Wise app that can be downloaded on your smartphone. Go to your Apple store, or I guess if you have a Samsung, go to whatever Samsung has to download that app. It helps us actually track, find whether or not you've been exposed, and also be able to track back where you've been so we can help others in the process. Also, if you have been exposed, we are now, we've been standing up different testing options available to you as well. Yesterday, I got tested at the Neighborhood Resource Center in Fulton, and there are some other options available. Thursday, tomorrow, 9 to 11 a.m. at Randolph Community Center. Tuesday, September 29th, 4 to 6 p.m. at Broad Rock Community Center. Wednesday, from September 30th, from 10 to 12 p.m., they'll be testing at St. Paul's Baptist Church North. On Friday, October 2nd, 1 to 4 p.m., they will be testing at the Eastern Henrico Health Department as well. Remember, these events are available to the broad public, regardless of insurance, citizen status, mobility, geographic location. If it would make you or your family feel a little bit more comfortable knowing about your status, we ask that you go ahead and get tested. Also, I will continue to remind the public that we are under a mask mandate. That means you must cover your face somehow with a covering or a mask moving forward to enter any public buildings and things of that nature. It always goes over your nose and your mouth, and masks are most effective when all parties are wearing them. Just because you're wearing a mask doesn't mean you shouldn't also social distance as well. So we ask that this is the one tool right here that we have without a therapy or a vaccine that I think is our best tool against this fight against COVID-19. So please continue to wear your mask. And if you need a mask or see someone who may need a mask, we ask that you visit rvastrong.org/get-a-mask. rvastrong.org/get-a-mask. Today, per usual, we have with us Dr. Danny Avula, who is the director of the Richmond City Health District. He is going to give an update on our current status as a community. Dr. Avula.
Thank you, Mayor. Good afternoon, everybody. The Central Region continues to be in a state of a high burden of disease with fluctuating trends. So Central Region currently is the only region throughout Virginia that still has the assessment of substantial transmission. Thankfully, things look much better here in the city of Richmond. We are now 24 straight days of decreasing case counts and case rates. Right now, we are at 10.4 cases per 100,000 population. The percent positivity has followed a similar trend, 17 straight days of a decreasing trend there. Today's 7-day moving average is 4.1%, and we've also had 15 straight days of decreasing numbers of outbreaks or clusters here in the city. Good news also is that testing is up. Last week we talked about the fact that we have had a drop-off in the number of people who are actually showing up at testing events, but we have seen that turn the corner a little bit. And so again, I just want to encourage anybody who is concerned about their exposure or who is having symptoms at all to go to one of the testing sites that the mayor just announced, or to contact your provider, or to go to a retail outlet or urgent care center to get. There are plenty of options right now to get tested here in the region. And I will say that as we have responded to clusters, outbreaks, to situations where we've had a large number of people being exposed, one of the themes that is really consistent is that it's people who had some mild symptoms, maybe thought it was allergies or thought it was their asthma, and opted not to get tested. And so I really just want to urge the importance and the availability of testing, even if you're having mild symptoms, because it can limit a number of people from being exposed. We also have seen the cool weather set in. We know that this is now flu season. Flu vaccine is becoming widely available. The health department has now 4 established mass vaccination events. If you would call 205-3501, our hotline, you can get details about those. Our first one will be October 2nd in the Southwood community from 4 to 6 p.m. But we are, as I said last week, we are inviting any partners who serve primarily vulnerable populations who'd be willing to host flu vaccination events. We would love to partner with you. So we have room and the opportunity to schedule many more flu vaccine events during this season. A quick update on COVID vaccination. We are still anticipating that those national trials will be wrapping up at the end of October or early November. If one or more of those vaccine candidates make it through, we would anticipate being able to distribute vaccine to those priority groups, the elderly living in congregate care facilities and frontline healthcare workers by the end of 2020. And then just on Friday, the long-awaited Halloween guidance was released from the CDC and from the Virginia Department of Health. Some of it should not be difficult. The main guidance was to wear a mask, good for both COVID and Halloween, but also to maintain small groups. The way that they've organized it is to grade it out by lowest risk, medium risk, and high risk activities. Our hope is that people really limit their trick-or-treating to small groups. If you're high risk in any way, it would be a good year to take a year off from trick-or-treating. And we really want to minimize contact. So in addition to wearing masks and maintaining distance, the more that we can wrap things in individual units and really minimize the close spacing of going from house to house. There's lots of ways: set up outside, have a bowl that people can pick things up out of. So there's a lot of guidance that is on both the VDH website and the RCHD website around Halloween practices for this year.
And Dr. Vula, I want to just thank you for updating the community about, was it 24 days now of declining case rates over the course of the last 24 days? That is a good thing. That's a positive. However, I will continue to stress the fact that we are not out of the woods. Dr. Vula will tell you with the flu season also upon us as well, we have to be even more vigilant now more than ever. We are not out of the woods. The numbers, the statistics look good. But obviously, these things can change truthfully overnight. And so we need everyone to continue to be just as vigilant as well, continue to wear your mask, wash your hands, keep your distance, and we're going to get through all of this together. As of Monday evening, we're moving forward with emergency child care in Richmond. As of Monday night's school board meeting, we were moving forward with the approach I suggested last week, using the model that works for our out-of-school time programming. So I want to give a couple thank yous. I want to thank the school board and Superintendent Cameras, his team for making all of this work. Look, it's important to remember that we are in uncharted waters, and we have to navigate them together in unity. All 5 agreed-upon schools will have operating programs within the next few weeks. Some programs are up and running or registering students right now. The Richmond Behavioral Health Authority has offered to host full-day facilitated learning support for RPS students with special needs at Blackwell Elementary School. They are working with the school administration to identify families who may benefit and will start reaching out soon. Today, I'm joined by John Lindstrom, who leads the Richmond Behavioral Health Authority. He'll be here to answer any questions if you have any. The YMCA has opened up the first school-based site at Miles Jones Elementary School. You can visit them at ymcarichmond.org and look up student success centers to sign up your family and your children. Reminder, the program cost is $33 per week. If you receive any federal benefits like TANF, SNAP, then the program is free. Program is free. Last week, I announced that we are allocating $1 million in CARES Act dollars to emergency child care provider support. I encourage all neighborhood-based providers to explore the application and see if they could potentially benefit from the program. The application is available on rvastrong.org under for businesses. rvastrong.org/emergency provider support. That is the link, rvastrong.org/emergency provider support. Also, we've designed this application to be very, very thorough, okay? But any city partner out there and staff are available along the way to help you through the completion of that application if you have any questions or concerns. Last week, I proposed allocating $500,000 of our surplus funds to alleviating health disparities in our city. Part of that sum will fund a pilot program dedicated to addressing mental health and substance abuse disorder challenges in our most underserved communities. People with mental and behavioral health challenges, like other historically oppressed communities, are experiencing compounded harms during the COVID-19 pandemic. Just one example, we know the number of non-fatal opioid overdoses have increased exponentially in the city. So using funds from the surplus, we're launching a year-long pilot program to increase accessibility of mental and behavioral health support during this unprecedented time. So here's why this is necessary. The Richmond Behavioral Health Authority does an admirable job of supporting patients referred to them. However, a very real stigma still exists around seeking treatment for mental health. We need a culture shift in this world because that stigma is both unrealistic and unacceptable. We need to get into the community and figure out what they need, allowing community input to determine the scope of these services. That's why the city is partnering with the Richmond City Health District and Richmond Behavioral Health Authority, tried and trusted partners in health policy and programming, to ensure a team is created to provide on-the-ground support for those experiencing mental and behavioral health emergencies in this most critical time. The RCHD resource centers, currently located within our most underserved communities, will be key hubs for providing these needed resources. We'll ask our team of city ambassadors to join the team as well, making sure residents know about the pilot and its services that will be offered. I'm thankful to RBHA, to RCHD, the Richmond City Health District, for embarking on this pilot with the city. Mental and behavioral health challenges affect each and every one. They do not discriminate. But I also will say they inflict a disparate damage on communities that don't have adequate access to these resources. So let me stress, this will begin as a pilot, but our intent is to make the mental and behavioral health of our underserved communities a long-term commitment and a priority as well. So that is moving forward, and we'll be willing to answer some questions on that when the time comes. Before I take questions, so I want to ask Mr. Cameras if you have anything to add, and is there any updates from Richmond Public Schools that we want to give to the community? Mr. Cameras.
Thank you, Mr. Mayor. Good afternoon. I would like to begin just acknowledging the passing of two of our students 2 nights ago, one from Franklin Military Academy, one who was most recently associated with the Richmond Alternative School, but both students had connections to other schools, including MLK Middle School, Chimborazo Elementary School, Henderson Middle School, and Huguenot High School. So if you would indulge me with another moment of silence in their memory. Thank you. Building on the mayor's comments, I just wanted to make a plea to our staff and our families. Anyone facing a mental health crisis, please, if you're a staff member, Cigna, our healthcare provider, provides mental health support. That is part of your coverage. It is critical that you take care of yourselves. I am not ashamed to admit I have sought such support over my life. The only shameful thing is when you don't ask for the help that you need. So please reach out. And families or students, if you are in crisis, please let your teacher know, let your principal know, your counselor, social worker. We have services to help you get through this. If you were sick with a physical ailment, you would get help. If you are sick with a mental, emotional ailment, you should get help as well. So please, please reach out. This is absolutely critical. Second, I just wanted to thank the school board, thank the mayor, thank RBHA, the YMCA, and other partners that have helped us move forward with the facilitated learning centers. In particular, I'm grateful to Mr. Lindstrom and RBHA, who will be providing support for our most vulnerable learners. And I think this is a critical need that we will be fulfilling. So again, thank you to the mayor, to the city for providing the funding and leadership on this. As a mentor of mine used to say, when the elephants fight, it's the grass that suffers. And this is a case where the elephants came together and worked everything out, and the grass is going to thrive as a result. And I think it's another example of when we all work together, the incredible things that we can achieve. So again, thank you for your leadership. Next, I just want to note that our meal program continues, hundreds of bus stops every morning. We do want to make sure all of our families know about this, that they access it. On Fridays, we give a double amount so that kids are taken care of over the weekend. Please check our website, rvaschools.net. On the homepage is a little bag lunch icon that says meal distribution. Just click on that and it gives you all the times and locations. We continue to update the locations based on community feedback. So if your family is struggling to get to one of the stops, please let us know so we can update our routing. You can always just email me directly, jkamras, that's Kamras at rvaschools.net. And last but not least, I just wanted to end on a highlight. As I think many folks know, we have started what we call the RPS Love Store. This is an opportunity for people to buy t-shirts and other regalia to show their love for RPS. We have so far sold nearly 600 items, t-shirts, hoodies, mugs, masks. All of the proceeds go to RPS families in need and to local racial justice nonprofits. So if you'd like to show your RPS love and help a good cause, please visit our website, rvaschools.net, and you'll see the link there to get to the online store. We're partnering with Bonfire, which is a local Richmond company, to do all of this work. Lots of great gift ideas as the holiday season approaches, so please take a look and show your RPS love. Thank you.
I got to say, there are not too many people who can pull off the t-shirt and suit. None like Mr. Cameras. He does it with such, I don't know. It's great.
I have to keep up with you.
T-shirt and suit, not too many people can do that. Buy the t-shirt, buy the t-shirt. We'll take some questions.
Mr. Mayor or Mr. Cameras, could you just clarify and walk us through the timeline for when the 5 schools might be open? I think I heard the Blackwell will be first, and just how parents can get their children involved.
Mr. Cameras, you want to?
I'm glad to.
Sure, okay.
The question was the timeline on the facilitated learning centers. I don't have exact dates just yet. We're still working through all the details, but as soon as we do, we will, of course, share that broadly. The registration is now up and running. That's the important thing. So families go to the link that the mayor put forth, I'm going to share it broadly on our communications channels as well. And as soon as we have 100% guaranteed information about the start date, we'll push that out as well. It'll be soon.
Hello, Henry.
For families, Mayor, maybe frustrated that getting the child care program in place is taking so long, what would you say to them? And my second question for you, Dr. Gould, was on the flu vaccination, which is, with it coming out more recently, I think we've seen a shortage of cells with people rushing to get them. What are your expectations over time with the flu vaccine? Will there be enough for everybody?
For those who are frustrated that it's taking a long time to nail down this emergency child care, I remind them that we've never done this before. We've never done this before. There is no playbook for how we handle these sorts of things in a pandemic, and we've never done this before. However, we do have a track record of working together. And what you've seen is the city coming together alongside our friends at RPS, saying that this is a need, this is a priority, and the adults have stepped up because we know that our families need this. And so we are working we're being diligent, we're dotting the I's and crossing the T's, and we're doing everything we can to get those sites open as quickly as possible. So I'm grateful to Mr. Cameras and members of the school board, their staff, and also to our partners as well who've come together to make this a possibility. There are school divisions and localities all across this country who are trying their best to stand up this sort of emergency child care. We're going to have one here in Richmond, and I hope it'll be a model for others around the Commonwealth of Virginia, too. Oh, Dr. Wu.
And then the question was, what do we anticipate or what do we hope for in terms of flu vaccine coverage, and are there any concerns about flu vaccine shortage? In different years, there are flu vaccine shortages depending on the manufacturer and the specifications and what's going on with the supply chain. There may be a strain on flu vaccine production given that we're also trying to build the machinery for COVID vaccine production. That has not impacted the initial distribution of flu vaccine. So right now, flu vaccine is widely available. Our hope, really the concern around the overlapping flu and COVID season is hospital capacity, right? From the beginning, we've talked about flattening the curve and the importance of keeping infection rates low so that there's enough room in hospitals to treat the sickest of the sick so that we have our best opportunity to help them heal and get them back out. So we want people to get their flu vaccine so we can avoid that double impact so that people can prevent getting the flu and ultimately potentially becoming hospitalized. The good news as we watch flu circulating around the world, particularly in the Southern Hemisphere, which experiences its flu season before we do, is that in at least the CDC released a report last week looking at Chile, South Africa, and Australia, and showed that through the peak of their flu season, they saw rates that were 10 times lower than normally expected. And the main thinking behind that is that the same things, the same behaviors that drive COVID transmission, drive flu transmission. So if we're doing our mask wearing and distancing and hand washing, that should have a significant impact on flu as well. Now, we want to do everything we can, and so we really want folks to get their flu vaccine, and so we're hoping that we can keep flu at bay in the midst of COVID continuing to circulate.
And it's interesting you said that, Dr. Villa. I think I was in Hillside Court recently, and the mother said that, the kids have not had any colds really this much this year, and she was surprised by that, and she said, because they're not in the schools, and the behaviors have changed, and so we're likely to see those behaviors as well change here during the flu season, but please still get your flu shot. I will be getting one here soon, right, Dr. Villa? I'll roll up my sleeve to make sure we're all protected during this whole most unprecedented times. Any other questions? Yeah, the question was about the first proposed MOU. Well, here's the thing. Everything that we do, we run through the city attorney's office, obviously. And we thought that we shouldn't reinvent the wheel as well, because we have a tried and true way on how this already works with our out-of-school programs. So we went about this another way, and that's working through RPS, them partnering alongside alongside our nonprofits that have normally worked with us. That's the better way for this whole thing to work. So there's really no backing out at all. It was more of a using, not reinventing the wheel, and using a tried and true way that is currently works for our out-of-school programs.
Paul, do you have a question? Cameron, you good? Henry, you good? All right.
All right. Thank you, everyone, and stay safe and strong out there. Cameron, what happened to your arm? Ooh. All right, take it easy. Take it easy. Thank you, everyone. That's a lot of ailments right there.